Welcome back to Nico's Perioperative, because staying curious makes all the difference.
It's great to be back.
Today we're going to really dig deep into enhanced recovery after surgery, ERAs for short, and how we can actually make this approach work, where resources might be a little bit limited, like those primary and secondary hospitals in low and middle income countries.
Yeah, great topic.
We've got some really interesting research, by the way, articles from the Journal of Surgical Oncology, the World Journal of Surgery, and even a recent Cureus article that looks at how ERS is applied across different specialties. Should be pretty interesting.
Yeah, it is exciting to see how ERS is really becoming more well-known around the world. Thinking back to when I first started practicing, the idea of getting patients up and moving around so soon after surgery, nobody was doing that. It was unheard of.
I know, right?
It was like a revolution.
Yeah, it really felt revolutionary at the time. Yeah. But, once you really start digging into the research, it's pretty clear that ERAs isn't just some passing trend. It's got serious evidence backing it up, and it really represents a change in how we view surgical care as a whole.
Completely agree. It's a whole new philosophy. It involves every single person on the surgical team.
Wow.
Surgeons, anesthesiologists, nurses, dietitians, physiotherapists, you name it, we're all in this together to try to optimize the patient's experience before, during, and after surgery.
Yeah. That's what I think makes it so important for us as anesthesiologists, right? We're kind of in this unique spot to really advocate for ERAs and to work with the whole team to make things better for patients.
Yeah, for sure. Speaking of patients, one of the best arguments for ERAs, especially in these settings where resources are tight, is that it can really close that quality gap in surgical care.
Now, I bet some people are thinking, hold on, isn't the biggest problem just getting people access to surgery in the first place? The access gap. Don't we just need more hospitals and surgeons?
Yeah, that's a huge issue, no doubt. But making sure the care people get is actually good, that's just as important. What's the point of getting surgery if you're just going to have a bunch of problems afterwards or a really long recovery because things weren't done the right way?
Right. That's where those guidelines from the 2022 World Journal of Surgery are so helpful. They give you really practical advice on how to make ERAs work, even when you don't have a ton of resources. It proves that you don't need all the fancy tech and a massive team to make a real difference.
Yeah, exactly. And that's what's so great about it. Even smaller hospitals can put some of the key parts of ERAs into practice and see amazing results. It's all about focusing on what you can control and using the resources you have wisely.
Totally. Well, let's get into some specifics, shall we? One thing that might surprise you is that they recommend doing preoperative HIV testing in places where HIV is common.
I know it doesn't seem like the most obvious connection to surgery at first.
Right.
But when you really think about it, knowing someone's HIV status beforehand lets us make better decisions, manage any complications better, and ultimately make the whole surgical experience safer.
Makes sense. It's like ERAs is about more than just a quicker recovery. It's about a complete approach and thinking about everything that might affect the patient's well-being.
Exactly. Another thing that often gets overlooked is delirium. Screening for it, preventing it.
Yeah.
It can be a real hidden problem, especially in a busy surgical environment.
You're right.
But it can have a huge impact on recovery. And research shows that simple, inexpensive things can make a world of difference.
Like what?
Oh, just making sure patients have their glasses and hearing aids, keeping them oriented, getting them moving as soon as possible, and involving their families. All of that can seriously lower the chances of delirium.
I never really thought of it that way. Imagine if you could make delirium screening as routine as taking someone's pulse or blood pressure.
Right. It would be a total game changer.
Yep.
Being proactive and anticipating potential issues instead of just reacting after they've happened.
Exactly. And speaking of being proactive, let's talk about those preoperative carb drinks.
Yeah.
The idea that something as easy as a special drink a few hours before surgery can actually lead to better results is pretty amazing.
It really is. It turns out that, major surgery, especially in the abdomen, it can trigger insulin resistance, which can slow down healing and make complications more likely.
Oh.
But these carbohydrate drinks, they're designed to help reduce that resistance and basically give the body a jump start on recovery.
So it's not like just grabbing a sugary sports drink. It's a specific thing with a real purpose.
Right, exactly. It's targeted. It has a real effect on the body.
Then there's the whole idea of early mobilization and feeding, which, let's be honest, it feels kind of counterintuitive after a big surgery. I know I'd probably just want to curl up in a ball and sleep for a week.
I hear you, but the research is pretty overwhelming. Getting patients moving and eating as soon as it's safe is really the way to go.
Interesting.
That Cureus article we mentioned earlier actually highlights a bunch of studies that compare ERS to the traditional way of doing things.
Okay.
And the results are really clear. Patients in the ERAS group consistently spend less time in the hospital, have fewer complications, and get back to their normal lives faster.
So basically, we're talking about challenging those old ways of thinking and embracing a more active, patient-focused approach.
Exactly. And when you think about the impact on the healthcare system, especially in places with limited resources, it becomes even more important.
In what way?
Shorter hospital stays mean more beds are available and resources go further. That saves money and allows hospitals to help more people.
I see.
Plus, fewer complications mean less work for healthcare providers who are often already stretched really thin.
It's like a win-win for everyone involved. Before we go any further, though, I do want to stress how important teamwork is to making all of this work. ERS isn't something one person can do alone. It needs a real coordinated effort from the whole perioperative team.
Couldn't agree more. We need clear communication, regular training, and everyone needs to understand why ERS is valuable and how they contribute.
Right. It's not just about checking things off a list. It's about creating a culture where ERS principles are part of everything we do in surgical care.
Exactly. That's why having those dedicated ERS teams, even in smaller hospitals, can be so helpful.
I see what you mean.
They're the ones championing the cause, providing the education and training, and making sure the protocols are actually being followed. They're the driving force behind that cultural shift.
You know, as you're talking, it really strikes me how important leadership is to making ERS a reality. It's not just about having the knowledge. You need people who are really passionate about this and willing to advocate for it, even when there's pushback.
Absolutely. I mean, let's be real. Implementing any kind of change in healthcare can be tough. But seeing the positive impact ERSS has on our patients makes it all worth it.
It is really rewarding to see patients recovering more quickly and experiencing less pain, getting back to their lives sooner. It really reminds you why we do what we do.
Totally. It's about restoring that sense of purpose and knowing that we're truly making a difference in people's lives.
Exactly. We're actually going to take a quick pause to gather our thoughts, but we'll be right back to dive even deeper into the world of ERS. Stick with us.
One thing that really stood out to me in that Journal of Surgical Oncology article was how they broke down the economics of ERS, especially that idea of value-based healthcare.
Yeah, that's a good point. It's a term we hear all the time these days, but it's worth really understanding what it means when we're talking about ERS.
Definitely. Value-based healthcare is about shifting our focus. Instead of just looking at best possible results for patients while being smart about how we use resources.
So it's not about cutting corners or being cheap. It's about investing in things that actually benefit both the patient and the system.
Exactly. And the Journal of Surgical Oncology article makes a strong case for ERAS being a perfect example of value-based surgery. They cite a ton of studies that show real cost savings with these programs, mainly because patients spend less time in the hospital and have fewer complications.
Which is huge, especially in those low resource settings where every penny counts.
For sure, ERS could really change the game, not just by improving care, but by actually making healthcare systems more sustainable.
Let's switch gears for a second and talk about sticking to those ERAS protocols. The research shows that the better we follow them, the better our patients do. But getting that consistency, especially in busy hospitals with limited staff and resources, that can be a real challenge.
It takes a lot of work, no question. But the World Journal of Surgery guidelines have some good tips. They emphasize the importance of constantly checking and evaluating how well we're following the protocols. It helps us see if we're on track and where we need to improve.
So it's not like we just set it up and forget about it.
Yeah.
We got to keep an eye on things and adjust as we go.
Right. And we need to make sure that everyone involved in the patient's care gets why ERA is important and what their role is.
Yeah, it's not just about blindly following a checklist. It's about building a culture where these principles are woven into everything we do.
Couldn't have said it better myself. And that's why having dedicated ERAS teams, even in smaller hospitals, can be so game-changing.
I can see that.
They're the champions, They educate, they train, they make sure the protocols are actually being put into practice. They're the ones driving that cultural shift.
It really makes you realize how crucial leadership is to all of this. It's not enough to know about ERS. You need people who are passionate about it and willing to fight for it, even when it's hard.
Absolutely. And honestly, changing things in healthcare is almost always an uphill battle. But when you see how much better our patients do with ERAs, it makes all that effort worth it.
It's true. Seeing patients recover faster, having less pain, getting back to their lives sooner, that's what makes it all worthwhile. It's a powerful reminder of why we do what we do.
Totally. It brings back that sense of purpose, makes you feel like you're truly making a difference.
Exactly. Now, I want to go back to something we talked about earlier, adapting ERAs to different situations and resources. What works in a big, well-funded hospital might not fly in a smaller one, in a rural area.
And that's where the World Journal of Surgery guidelines are so helpful. They give you this framework that you can adapt to different contexts. It ensures that the core principles of ERA stay the same, even when you have to work around limitations.
So it's about being creative and flexible, finding ways to put the spirit of ERAS into practice, even when you don't have all the fancy tools and resources.
Exactly. It's about focusing on what really matters, providing patient-centered care based on evidence, and doing everything we can to get the best possible outcomes and make the whole surgical experience better.
And as anesthesiologists, we're in a great position to lead the way. We have the knowledge, we have the skills, and we have the opportunity to truly make a difference in how surgery is done.
No doubt about it. By really embracing the principles of ERAS and working closely with everyone on the surgical team, we can transform care for the better.
It's an exciting challenge, and I'm all in.
As we wrap up this deep dive on ERS, especially in those tougher settings, it makes you think about why this is so important for us as anesthesiologists.
Yeah, absolutely.
It's easy to get caught up in the daily grind.
Yeah.
But we have to zoom out sometimes and see the bigger picture,
Right. It's about advocating for our patients.
Yeah.
Making sure they get the best possible care. Doesn't matter what their situation is or what resources are available.
Exactly. And ERIS gives us the tools to do that, right?
Right.
It's about pushing the limits of what we can do in surgical care and leaving behind those old ways that just don't work anymore.
Pushing boundaries, challenging ourselves.
Embracing new ideas, always trying to improve, even when things are tough.
It's also about recognizing that even small things can have a big impact, like those carb drinks we talked about. Such a simple thing, but it can really change how a patient recovers.
Absolutely. It shows how ERAs is about understanding what's going on in the body and using that knowledge to do things that actually help.
And we can't forget about that feeling you get when you see your patients doing well. It's pretty amazing to watch someone recover quickly, have less pain, and get back to their life sooner.
It's the best. Reminds you why we do what we do.
Totally.
Yeah.
It's about finding that joy in our work, that sense of purpose, knowing that we're making a real difference.
Couldn't say it better myself. That sense of purpose, it's crucial, especially when you're working in tough situations.
Throughout this whole conversation, it's really struck me how broad ERAs is. It's more than just guidelines. It's a whole way of thinking, a commitment to doing perioperative care the right way.
It's a journey, always learning, adapting, working together.
And on that note, we want to leave you with something to think about. As you go back to your practice, what's one thing from this deep dive that you'll actually put into action? Or something you'll advocate for?
How are you going to use your skills and your influence to champion ERAs? How will you make a difference for your patients, for your hospital, for your whole system?
Remember, even small steps can lead to big changes. Stay curious and keep pushing the limits of what we can achieve in perioperative care.
Stay curious.